and a very warm welcome to our 7th Wednesday welfare webinar. It's quite a mouthful to say that. You're joining us by Zoom this evening, and you're very, very welcome. We're just going to do a little dance whilst we wait for Facebook Live viewers to join us, which I'll do very shortly. It's great to have you with us. As I say, it's our 7th webinar. We've covered things like weight management, transport, disease, fitness, and worming over the course of our series of webinars, and we're looking to carry them forward through the winter as well. So we look forward to, hopefully you'll join us for those, and if you're joining us tonight and haven't been able to see some of the initial webinars, then they are available on our YouTube site. Good evening, and everyone who's joining us on Facebook Live as well, to our 7th Wednesday welfare webinar, which this evening is on equine dentistry. And I'm delighted that Alice Hughes, vet and a qualified equine dental technician, and Eileen Gillen, centre manager for our Scottish Rescue and Rehabilitation Centre, Belwade Farm in Aboyne, are joining us. We really want you to sort of feel involved in this. So if you are joining us on Facebook, then do please share the video. And as I've just been saying to our Zoom followers, if you are interested, this is the 7th webinar. All our others are recorded on our YouTube site. So if you enjoy this evening, then please do tell your friends and colleagues about it. We really do want you to get involved. We have two 20-minute presentations, and then we'll have a Q&A session at the end, and we'll do our best to get through all the questions. So if you're following us on Facebook or viewing us through Facebook, then please use the comment section, and for Zoom, please use the Q&A section or the chat function on Zoom. If you're joining us also by Zoom, we've got a couple of poll questions during the course, and you're very welcome to be able to do that. Unfortunately, if you're on Facebook Live, you won't be able to, but you'll be able to obviously see the results. As we mentioned earlier, we're looking to run these through the winter. So if you've got topics that you would like us to cover, then please do let us know by emailing us at education@worldhorsewelfare.org. So we've got a poll question, and the first poll question coming up, in fact, do I need to, hang on, sorry, you would have thought, as I say every time, that I would have worked out how to do this. I've now got to share my screen, and then we'll be able to, am I sharing the right screen here, Basil?
Yep.
Brilliant. So let's get through to the first poll question. This is not a test. Now, we appreciate it could be a matter of debate, but we just want you to sort of get involved. So how often do you think a horse should have its teeth checked by a professional? And as you can see there, we've got options, everything from every 3 months to you weren't sure that a horse's teeth needed checking. So whilst you're answering that question, I'll just tell you a very little bit about World Horse Welfare. I very much appreciate it. If you're joining us for our 7th time, this is the 7th time you'll have heard it. So I'll try and say something different tonight. But at our heart, World Horse Welfare is about supporting the horse-human partnership in all of its guises. And of course, today that is in so many different ways: as an animal for sport and leisure, as a farm animal, as a working animal, as an animal for therapy, and so many others. We are a practical organisation, and we are working in 16 countries across the world. As I say, we support the responsible use of horses in all its guises. Eileen is from one of our 4 rescue and rehoming centres in Britain, and we provide care, we promote research, we shape laws, and we raise welfare standards through education. And of course, that's what tonight's all about. And tonight's topic is about equine dentistry, equine teeth and dentistry. And of course, a horse's mouth is possibly an area of mystery for many of us. We might be familiar with the front of the mouth, but what goes on inside might be more unknown to us. And of course, as horse owners, we've got so many priorities to juggle. So tonight, with Alice and Eileen's help, we hope we can provide you with some practical advice on how we can care for our horses' teeth and their dental health. Of course, equine dentistry is a relatively new specialism, and so we hope after tonight we will sort of debunked some of the issues around equine dentistry and given us all an opportunity to be more confident in how we can care for our horses' teeth. So before moving on to Alice, let's see what we have in terms of the poll results. So we've got no one's saying every 3 months. The majority are saying every 12 months, followed shortly by every 6 months. And actually, that's, as I say this quite often, it's quite unusual. There's several answers there which are not answered at all, and normally you get one person answering everything. So Alice, I'm sure, might refer back to that. But now I am delighted to introduce you to Alice Hughes. As I say, not only a vet, but an qualified equine dental technician as well. And at home, Alice has a vast collection of cats, dogs, hens, and horses, many of which are rescues. And I love this. The pride and joy of our horses being a 32-year-old pony who not only taught Alice to ride as a child, but was taught both her children. He's still going strong, and he still has his teeth. Now, I can't think of a better reference to than that for Alice. So, Alice, over to you once I've stopped sharing my screen, which I have now.
Thanks for that, Robbie. I'll just share my screen with you now. So, we'll get this started. There we go. And I'll just get my pointer on the go. Yeah, so thank you for that. So yes, I'm just going to go through equine dentistry. So we'll start with anatomy and then work our way through these topics. So when you're looking at the side of the horse's head, you can see you've got your lower jaw here, the mandible, and your upper jaw, the maxilla. This is the eye socket here, as you can see. And you have your incisors at the front, and then your cheek teeth quite far back in the mouth. And then if you look through a section portion of the skull, this is actually an older horse, so the teeth are actually quite short. And this image shows here that actually in younger horses, the teeth fill up a vast majority of the skull. And when looking at all the teeth that the horse has, you have on each quarter, you have 3 incisors, so 6 on the top, 6 on the bottom. Male horses tend to have 4 canines. Mares may have canines, but often don't have any. These small teeth here are your wolf teeth or vestigial premolars. Again, often it's just the top ones, and often horses don't have them at all. And then you have each quarter has 6 cheek teeth. And we number them the same as human dentists do, so your 100s, 200s, 300s, and 400s. And that's just so we can communicate between vets and technicians on what tooth we are talking about. Humans are brachiodonts, and this is the structure of our teeth. So the top of our tooth is the white enamel that we see. We have one pulp chamber towards the top of the teeth with usually these 2 pulp horns coming down. Horses are hypsodonts, which are very different. So although we both, hypsodonts and brachiodonts, have your baby teeth, your deciduous teeth, followed by adult teeth, our adult teeth stay in situ, whereas horses' teeth will erupt out into the mouth over time. Due to horses chewing grass for their diet, the teeth wear down over time. The top of a horse's tooth has all 3 dental tissues exposed on the surface, and the enamel, this white structure here, is ridged on the top, and that's all to aid with the grinding of their diet. Horses' pulp chamber is at the bottom of the tooth, with the pulp canals going up towards the top, and so it makes dealing with disease in horses' teeth very different to human teeth. The top teeth as well, so the maxillary teeth, so in the top jaw, are also, the anatomy is very different to the bottom jaw teeth, the mandibular teeth. So on top teeth in horses, they're quite square, and you can see they have 2 central channels of cement called the infundibulum, and they have these pulp horns. Depending on which tooth, the middle ones will have 5 pulp horns, the front one's 6, and the back one's 7. and these pulp horns extend up towards the apex, the top of the tooth, surrounding these infundibula, the channels of the cement in the middle. The bottom teeth of horses are different again, so they're more rectangular, and they have the same number of pulp horns generally, but they don't have these central channels of cement. And that means when we're examining a horse's mouth, we're looking for different disease processes depending on which tooth it is. I'll just briefly touch on aging, but you can see this is a young horse, and these are the deciduous incisors, and this is an older horse with the adult teeth. So baby teeth tend to be whiter and more shell-shaped, and adult teeth are longer and often darker stained. When you're aging a horse, if it's under the age of 5, you can do it just by the eruption of the incisors. So these baby centrals come out at about 2.5, the middles 3.5, and the corners 4.5. So on this horse, you can see this is a baby tooth here, whereas this is an adult tooth that's just erupted. So this horse will be about 4.5. This is just erupted, and this cap or baby tooth is obviously just about to come off as this adult one erupts and pushes it out. And again, this is a deciduous baby tooth that would have been pushed out by the adult, and this is actually of an old Shetland pony, so it's a bit small in comparison, but an adult tooth which is quite narrow and has this long root and triangular. Generally, when you're looking at the shape of horses' teeth, when they're younger, they're more upright, and as you get older or long in the tooth, they become more angular and angled this way. You hear people talking about Galvin's groove, which sort of starts erupting on the corners, comes all the way down and then all the way out. But it's pretty inaccurate for aging. But it's an extra guide. You can also age them by looking at the chewing surface, the occlusal surface of the tooth, depending on where the cup, the infundibulum, or the pulp, the star, is on that tooth wear-wise. But again, not massively accurate depending on the breed and the diet that the horse has been on. But there are guides. Luckily, now with passporting and things, it's less of a guess job. So routine dentistry. When do I need to get my horses done? Obviously, it's quite reassuring to see on the poll that a lot of you are getting them done every 6 or 12 months. Generally, we say younger horses, because their teeth are erupting more quickly. Young horses' teeth erupt up to about 8 millimeters a year, whereas older horses, although they're not erupting quickly, they're only erupting possibly 1 millimeter or 2 a year, they do develop other problems, such as gaps forming between the teeth, etc., which we'll touch on later. So at those younger and older horses, I would do every 6 months, or if your dental technician or vet has diagnosed a problem. The horses that are in between this age group and don't generally have problems are fine getting checked annually. When else should you get your horse's teeth checked? They have nasal discharge, quidding, which is dropping food whilst they're chewing, weight loss, if there's a malodor or smell coming from the mouth, ridden issues. Obviously, there's a whole plethora of causes for ridden issues, but certainly teeth could be one of them. Bitting problems, is the horse reluctant to let you put the bit in the mouth? Again, could be several problems, but bitting teeth might be one of them. Any swelling surrounding the jaws or the face, and also just anxiety around the head could indicate that there's pain. So when you look at the anatomy of the skull, you can see that this top jaw, this maxilla, is wider than the bottom jaw. So you get this edge of top teeth that as they erupt, they don't wear against anything below. And also on the inside, on the lower jaw, the inside edge doesn't wear against anything. So that can get excess enamel growth there. It doesn't show it very clearly on this skull, but also the top jaw can sit further forward than the bottom jaw. So sometimes you get enamel overgrowth at the front of the upper jaw, and also at the bottom of the back of the lower jaw. This is an image from 1390 from the Vatican Library, showing presumably an equine vet having a look inside a horse's mouth. So dentistry really isn't a new thing at all, but it has considerably changed. Even in the last 10-15 years, there's been big advancement. I'm not sure why this owner didn't get dressed this morning. So in the UK, there are a couple of authorities who regulate equine dental technicians. To become a member of the British Association of Equine Dental Technicians, as I am, there's actually quite a, it's hard to pass the examinations to become a full member, and there's ongoing CPD, professional development, and examinations and studies that have to be done. And you can go onto their website to find the list of all the local registered EDTs in your area. There's also the Worldwide Association of Equine Dental Technicians, so they have a similar list on their website. But really, to ensure that the person looking after your horse's teeth is appropriately qualified, you want to make sure they're on this list, or they're an equine vet interested in dentistry. So for routine dentistry, there's quite a fair amount of equipment required. So we need a speculum or a gag to look inside the horse's mouth, a good light source, notes so we can chart what problems the horse has had and what we found, and so the owner can keep the records for next time. As a vet or a member of the BAEDT or WWE, you can use electric rasps, which I find to be much more accurate and efficient than manual rasps, but it's some personal preference. And a good headstand I find essential. So I do most of my dentals sedated, with them resting on a headstand, and then you get good visual field into the back of the horse's mouth, and can do the best job possible. And you know, if you don't have a headstand the right side, this is at Belwade, you can improvise. This is actually a filling, but that wasn't the point of the slide. Was more to show how a mirror is essential. Just looking along this row of teeth, you wouldn't necessarily spot that there was an issue there, or that something had been done there, unless you're looking with a mirror and you have a clean mouth. So we wash all of the food out of the horse's mouth, and they're standing nice and still, hopefully with a good light source on a headstand, and then a mirror can show you the pathologies in the mouth. This is at Belwade Farm, and this was just to show the ideal setup. So another reason I love going to Belwade is we have the stocks and a lovely big area, and a good headstand ready, waiting to go. So we'll just go through some of these common problems. Wolf teeth, these ones are actually set quite far forward in this horse's mouth. When you're riding with a bitted horse, the bit will sit in front of this first cheek tooth. So if you have large wolf teeth or loose wolf teeth, or ones that are like this one are sighted quite a bit away from quite a bit in front of the first cheek tooth, this will interfere with the bit when you're riding. And so generally we take these out. Not all horses develop them. Even if they do develop them, they often fall out of their own accord. But when this first baby cheek tooth falls out at 2.5 years old, it does often take the wolf tooth with it. But if it hasn't, and we're examining the mouth, and we tend to take them out, and that requires sedation and local anaesthetic. And generally the roots are pretty small on these, so it's not a big procedure for the horse. Ulceration is caused by these sharp enamel points that we get more along the cheek side of the upper jaw, or the tongue side of the lower jaw, and at the front of the upper jaw. And you can see these, you know, they'll cut your hand when you're examining the horse's mouth, and they also cut the cheek, and often next to these front premolars, front cheek teeth. This is where your nose band or your flash might be, and so it's really pushing the cheek into these teeth. And again, here's a big focal overgrowth on the front of that first cheek tooth, and a nice slice to the cheek there, and that's going to be very uncomfortable to the horse. But once we've rasped these overgrowths off, the ulcers will heal, within that week. And this is on the tongue from the sharp enamel points on the inside of the lower jaw. And again, you can imagine how painful that's going to be for the horse. Overgrowths, which are just an extension beyond that, the sharp enamel points. I think this was a 15-year-old Shetland at Belwade that had never had a gag on before. And because its top jaw was set slightly further forward than its lower jaw, these just had nothing to wear against. And so this, as you can imagine, with the mouth closed, this was causing a lot of trauma to the lower jaw and also impeding chewing significantly. So you can take overgrowths down, but this black dot here that you can see under my marker is the dentin that covers the pulp, the sensitive part of the tooth. And you can only rasp that overgrowth until that pulp, that dentin overlying the pulp, starts to change colour. What we don't want to do is overheat the tooth by taking too much off, or expose the sensitive part of the tooth, because that will be in a worse situation than we were before. And then you can see that's the dentin changed to a dark brown colour rather than the black colour. And so we don't want to take any more off than that. You can also get overgrowths in the back of the mouth. This horse had an upper tooth extracted, I think this was 6 years previously, or maybe even 5 years previously. And then unfortunately, the horse changed hands and didn't see a gag afterwards. And so this tooth opposite had nothing to grind against and just grew up into this space. And you can see on x-ray, this was after I'd reduced it as far as I could, but you can see how much, with the jaw closed, how much that would be impeding the chewing when the horse is trying to eat. Also has fractured teeth, but that was another issue for that horse. So we'll then go on to diastemata and periodontal disease, which is gum disease. And this is incredibly painful, I feel, for the horse. What you commonly see in possibly younger horses more often are these valve diastema or valvular diastema. And that's basically where from the top of the surface of the teeth, it looks, like there's a good junction, but then the food gets letterboxed basically in between the teeth and erodes the gum line. And you know what it's like when you get something stuck between your teeth just temporarily, how painful it is. And these horses are often living with these for long periods of time. Open diastema are basically any of these gaps. So if you have a tooth removed, that would be an open diastema. And often older horses will develop these gaps. Sometimes less problematic than valve diastema because the food can go in and come out as well. But again, both these problems can cause a lot of ongoing management issues. This is a valve diastema, so that's the teeth are meeting at the top but getting pushed down into this gum line, which will be very painful. This is another example. Generally what we try and do is clean out all this stuck food. So the first thing is actually identifying the problem. And often because they're right at the back of the mouth, hidden behind the tongue, these problems are missed, but the horse will be quidding. But once the problem's been identified, then we can remove all this trapped food. Usually there's an underlying problem, whether it's the horse's anatomy, or actually in this case, you can see that this tooth is a bit higher than this tooth. So when this horse is chewing, the food will be meeting a stopper here and then getting pressed down. So by cleaning out all of these, all of the trapped food, then trying to sort out some of these balance issues within the mouth, it's possibly changing the horse's diet as well, so it's on a less coarse diet, getting stuck in these gaps. then hopefully that will resolve the problem. If it doesn't, then there are measures we can put in place, such as widening these gaps, so basically turning a valve diastema into an open diastema, or partially doing that, which is what we tend to do now. But these are, again, often they're ongoing management and the veterinary problems to deal with. So peripheral caries, peripheral just meaning the outside of the tooth, which is covered in cement, and caries being the decay. So often these are associated with diastema. So wherever you get food getting trapped, you get bacteria feeding off it and producing acid, and it can decay the outside of the teeth. Because the teeth are continually erupting, if you can find the cause and get rid of it, then hopefully healthy cement will then erupt with the new tooth as it erupts. But diet can influence this as well, but often there are ongoing disease processes at the same time. And then infundibular caries, going back to the anatomy, on the top teeth you have these infundibulum. So it's the channels of cement in the middle of the tooth. And often what is thought that when the horse's teeth are developing, in certain teeth particularly, there'll be areas where the cement hasn't been produced properly. So you'll have areas of holes within these infundibula. And as the tooth wears down over time, you will reach these holes. And then the holes pack with food. And then again, the bacteria feed off this food and produce acid and decay the tooth. So if we can identify these on our routine dental exams with our mirrors and our washing all the food out of the mouth, we can see, there shouldn't be any probe depth here at all, but we can see that that file's a good inch long and it's almost all the way in. If we can identify these, then we can treat them before they become a problem. So if that was left and it decayed out the tooth from the inside out, it would result in a fracture or infection within the tooth. So again, this is at Belwade, and we can have our nice setup here with our oroscope, so a camera looking inside the horse's mouth, and an endodontic unit, and just the horse understanding sedation. And then we can see with our oroscope on the laptop this hole in the tooth that shouldn't be there, and it's packed with food. So we pick out all the food, and then that's drilling out the food and cleaning out all the rotten cement that's been stuck in there. And then the photo doesn't do it justice, but I think this was 30 millimeters deep. So these are deep cavities within the tooth. And then just using a dental resin filling material, we can then fill these cavities, providing we've got them nice and clean. And then this filling should last the horse for life. Another problem that we commonly come across, which again is important to pick up on our routine exams, is pulp exposure. So these were our infundibula, which we've just talked about, and these are our pulp canals. So this is secondary dentin, which should be black and shiny like this, but if they become open and filled with food, this is what the problems that we need to be identifying. If you've just got one or two or possibly three small open pulp horns, then you could potentially use root canal therapy, so you can clean out the infected food-filled pulps and fill those and save the tooth, depending on whether infection has already taken place at the top of the tooth. But when you've got three large open pulp horns or more, and there's changes on X-ray, then really extraction of the tooth is your only way. And that extraction of teeth is, again, now just done under standing sedation 99% of the time, just with a drip with your sedation in it through a catheter, using sedation and nerve blocks. And you can see actually on your oral exam, this is quite a good one. I think this horse had 5 open pulp horns and the tooth was completely dead. And you can see that it's a different colour to the tooth in front. And that still could be easily missed if there was food still in the mouth or if the horse was moving around. And this again is a probe going into the pulp horns. So when we're extracting a tooth, we just widen the spaces around the tooth, and then grasp the tooth, and then pull it into the oral cavity or lever it into the oral cavity. Yeah, this is just showing. So these should be completely solid on the surface with just live pulp tissue in, but you can see it's just completely filled with food. And that was just waiting to fracture or develop an apical infection, which would have been very painful for the horse. You also can get pulp exposures on the incisors. Again, this horse has obviously worn its incisors down excessively over the protective dentin. And we can do root canal on these incisors if the tooth allows. And this is also the importance of looking at your incisors on an oral exam. And this was just a tiny little hole with pus draining from it, and that tooth was infected, and you could get this file all the way to the top of the tooth. And we can do root canal and incisors relatively simply because there's only one pulp horn involved with those, similar to us. I'll just quickly touch on sinusitis. So if you have a very smelly discharge from one side of your horse's face from one nostril, that may well be a sign of tooth disease. So this is a brilliant book actually that people can get free, I think, from apps from the University of Georgia on the anatomy of the sinuses of horses. And it just shows you that the back two cheek teeth here communicate with this caudal maxillary sinus, and then the next two communicate with the rostral maxillary sinus. So if you get infection in the top of one of these teeth, say because of a pulp exposure or a fracture or infundibular caries, then these air-filled sacs can become filled with pus, and then that's what drains out of your nostril. And they can be a real nightmare to sort out and flush out. So we want to be identifying these tooth problems early before things like sinusitis develop if possible. Fractures, again, these fractures here are all secondary to other problems. So these were secondary to infundibular caries. It basically just rotted the tooth up the middle, and this is the sort of problem you then have to deal with. And then just lastly, a disease of incisors, which is a ridiculously named disease, EOTRH, which basically is resorption of the incisors as well as hypercementosis, laying down extra cement on them. Although we often don't see this part in the UK, it's often just resorption. So if you have an older horse with incisors that look a little bit like this, it's probably EOTRH, and that's basically thought to be like an autoimmune disease where the incisors are slowly resorbed over time, and this can be incredibly painful for the horse. You can see the bulbular look above these teeth, and these horses are far better with the teeth removed. And this is just an X-ray showing this hypercementosis and also resorption of these teeth. So if you have a horse that won't bite a carrot in half, or it's painful around its incisors, or they look even in the mild stages like this, and the teeth are slightly loose, it's far better to get these addressed. The horse will do much better without its incisors than it will with painful ones. Great, and that's everything I had to say.
Alice, thank you so much. I don't know what others feel it, but whenever we have a presentation about dentition, I always start to get sort of toothache myself. But that was fascinating, and a great example of where prevention is so much better, isn't it, than having to cure some of these problems. But there's lots of questions starting to come through. So if you do have your question, as I mentioned at the beginning, please do put them through on the Facebook comment section, or on Zoom on the chat or the Q&A function. So that's great. So now I'm going to share my screen again, and I will introduce our second speaker. Sorry, let me just get that going. A little delay whilst it sorts itself out. Right, so I'm just about to introduce you to Eileen, but before we do that, we'll have another round of a poll. And this is, how easy is it to find a trusted professional to provide dental care for your horse. So here we've got a series of options from very easy all the way through to very hard, with various different options there along the way. So whilst you're thinking about that, I wanted to introduce you to Eileen Gillen, who is our centre manager for Belwade Farm, our rescue and rehoming centre in Scotland. Now, in times of COVID, obviously our farms are closed, but do put it in your diary of things to do over the next few years to go and visit Belwade, because it is a jewel in the crown of World Horse Welfare. All our centres are great places, but where Belwade is a very special place on the banks of the River Dee. Eileen has been with us, quite extraordinary, for 30 years, celebrates her 30 years this year. 10 years ago, the Princess Royal gave her a letter recognising her 20-year service. In times of COVID, unfortunately, she'll probably just have to make do with a postcard from me, but 30 years at Belwade is wonderful. And but what I love about going up to Belwade, other than meeting the team, who are always superb, is Eileen's Basset hounds, who are always from a discipline point of view, always push the boundaries, but are always great fun to see. So Eileen has obviously had a wealth of experience across before joining us, and then and since she's joined us 30 years ago, she's had an involvement in so many different aspects of our work, but now very much has overseen the expansion Belwade to the extraordinary place that it is today. And as you heard from Alice, she loves visiting, and you will love visiting too. So before I hand over to Eileen, let's find out what your answers to the poll were. So a good selection here. Very encouraging that 31 and 38, so 69% find it easy, with a fairly good split between using a vet and an equine dental technician, but over a quarter of you finding it, well, over nearly a third finding it challenging. So that I think that is encouraging to a degree, but it shows that it is, for some, it's still a real challenge. So Eileen, I'm now going to stop sharing my screen, and I'm going to hand over to you. And you'll come off mute and we'll get on much better.
I'd much prefer to do it with mute, but however, good evening everyone. Just give me a chance to just set my screen up. And while we're doing that, do we know that the word dentist is actually a very protected word, and it is only since 2006 that vets and the Royal College of Veterinary Studies and BEVA actually managed to persuade them to be able to use the word equine dentist. I mean, I thought that was actually quite interesting. I mean, the state of dentistry for horses is relatively new, as Alice said. And since my time here at Belwade Farm, the progress that we have made has been absolutely insurmountable. So enough doing my slideshow from beginning, and here we go. All right, don't look a gift horse in the mouth. Well, I would seriously suggest you do. Why is that? Now let's just recap. Why would we want to look after our horse's teeth? Well, it is the start of good digestion of food. It's vital, in fact. We know that we have incisors that bite and tear away at the grasses or haylage, hay, and then through transference by the tongue, the food goes back to the molars. The molars are the grinding factors of good digestion. Those molars will want to be able to grind food down to around 3 millimeters. That's not even the size of your fingernail. The enzymes of the digestive tract is going to start in the mouth with saliva. It will then, if it's all going well, it will then transfer down the esophagus straight into the stomach. As we know from other areas, the stomach is relatively small and then leads into a very long digestive tract. In the wilds or semi-ferals, I mean, a horse will eat up to 16 hours a day. If you've looked at previous webinars, you will see the reason for this. But by domestication, now we're talking about a couple of hundred years here, that we have created a situation for the horse that whether we're stabling them or putting them into a paddock, it means that they have less work to do to find the food. How do they find food? Through their muzzles, through the whiskers, and then they know how to find good grasses to be able to eat. Horses, at the end of the day, were put on the planet to eat grass. I will at this point involve donkeys here. Now we're looking at horses generally, but donkeys are part of the equine world, and they too will follow suit. So let's not forget our donkey friends. Now, as Alice has said, prevention is very much better than the cure. Ideally, and you can read through this, we would very much like people to start really looking at the foals at the beginning of their life, to really have a good inspection of the way the incisors are forming and the molars, and to be able to give this foal that you've possibly brought into this world to lead a really good life and long one. But it all starts with the teeth. As long as they're able to eat well, there's no reason why they can't endure a very good life afterwards. So yes, it might sound quite expensive coming up to 8 years of age of 6 monthly, but how much does the colic surgery cost? How much do you not want to see your horse choke simply because we have not identified good teeth? Now I'm bringing a couple of slides here, and I know Alice has actually produced some of these, and I put the adage there, a bit long in the tooth. Now when we think of this, we normally think, oh, it's an old horse, but I'm taking it a little bit further, and we're looking at these overgrowths that Alice has already described. We at the farm are actually finding these a little bit too often, unfortunately. Now, why is this? I'm not the equine dentist, and I think Alice has actually explained that really well. But when we look at these two mouths, they're both different horses. As is already described, that the molars behind these overgrowths have actually worn down quite well. But how many of us have horses that have changed behavior, have started rearing or bucking, or going and shying away from being bridled? Or, you know, how many different afflictions can we actually put to this? And then the next question I would ask, how many of us as riders or drivers will actually look to changing the bit because they're taking too much of a hold? So we think that they need to have a stronger bit. Or they cross their jaws. We look at different nose bands to try and keep their mouth closed. Meanwhile, the horse is trying to salivate more to try and get away from that discomfort. Where really, the first port of call when you see this behavioural changes and actions of the horse, ask your vet and your dental technician to just open their mouths and just make sure we're not creating something that we don't really want to have to deal with. Now I know these two images are quite extreme, but if you do not have a good dental examination, then this can be produced really quite easily these days. The front of this molar is actually, Alice produced this wee Shetland pony, and again, I'm just going to go through a series of progression that Alice had to do to make this Shetland more comfortable. Now, when you think that he had a massive 2 centimetre overgrowth, and it was boring into the lower jaw in the soft tissue. So over a period of 5 sessions, we have the initial, that's the tooth onto the left of your screen, taking off, and when you're starting to take off parts of the teeth and rasping, and people think, oh, I've just rasped a horse's teeth. It should not be any more than 4 millimeters at any one time. How people can do that by not opening up the mouth and actually having a good light to be able to know that they've done that. The days of using the terminology of floating and rasping are really getting a little bit old, or old in the tooth, excuse my pun. So as we progress through this, and as Alice has already described in her presentation, that the end to the right, she has managed to file off as much as she possibly can before she gets into the sensitive area. To say that this pony has actually progressed from here and we have managed to rehome him on our rehoming scheme is absolutely amazing. And our new rehomer for this pony knows that we have to keep a check every 6 months on this so that he can actually eat and live a long, happy life. Another couple of slides that you might be interested in. Now, as Alice suggested and shown, that the incisors, the biting teeth. This is I wouldn't say it's an old horse at all because but it is an adult. But you can see that we have a problem where the corner teeth on the left is growing or overgrowing from the corresponding to the right. You can see the occlusion, now malocclusion, is where the contact is. So I get a bit tongue-tied saying malocclusion, so I say abnormal contact. But if this horse was to continue without vet and dental intervention, this tooth would only overgrow so much that it will cause problems later on in its life. We'll also see from the two central incisors that they're not meeting the tooth. Now, whether you would like to call that a slant mouth, whatever, with dentistry, equine dentistry, we can align this a little bit better and give help to this pony to be able to eat properly for the rest of its life. Again, 6 monthly checkups will be the course of action. This pony has also been rehomed successfully. The pony on the right, now this is an unusual one, and I have to say this was not Belwade horse, but we have seen it at our farm, so it's not unusual. It is actually one from another of our farms. And it's interesting to see that the central incisors in the middle are saying that it's quite young. The second incisor towards the right has been trying to roll through, but has been inhibited by this rogue tooth, which is lying underneath. Now, I showed this to Alice and I said, what do you think? Well, her answer was, well, that's an interesting mouth. We're not quite sure which is the young tooth, or the foal, I should say, or the actual adult tooth. So on that, she says, I'd love to have a palpation of that, and then we would be following it up with X-ray. So what I'm trying to say with this slide is that if you're going to buy a young horse, and you might have a vetting and you're seeing it orthopedically wise, surgically wise, soundness wise, just ask about their teeth, because you could be opening up a can of worms here. I'm not saying that this is a no-hoper. It is not the case at all. With proper equine dentistry, this can be resolved, and was. Now, I'm very sorry and if these disturb you, I am sorry about this. However, in the world of welfare, we do come across mouths that we're not very happy about. The one on the left is a youngster. It's actually probably very young. It's a bit difficult to tell by its upper incisors, but if you look at the corner lower incisor, you will see that it's still a milk tooth. In the world of welfare, as we do in World Horse Welfare, we see a lot of foals, youngsters that come into this world and they have insufficient food, they have insufficient care, and therefore, even at that young age, their life could be compromised. Now, I don't want to be all doom and gloom. The good news is that it is young. These are deciduous teeth. They are going to fall out. We know that adult teeth will probably come through at some stage if it's given good nutrition, etc. The nutrition side of things The incisors, yes, they are important, but the main thing is that the molars are important. They're going to grind the food. And horses are amazing. They get round this sort of affliction. They shouldn't need to, but they do. And as this young horse will age, now we hope that the adult teeth will come through and it can go on and lead a good life. Why does it happen? Possibly bad nutrition. We see too many cases that when there is no food for them, their dam might have just run out of milk, or it's been poor quality milk. They will search. They want to live. They will search out something that will either give them minerals and vitamins and some sort of fiber. So this particular case probably ate trees, probably fences, and we have seen them actually eating stones to try and get the minerals absorbed. They don't want to give up. They're amazing creatures. The one on the right, very similar, but slightly different. This did come into Belwade. And when Alice inspected and had a good examination, we realised that we had a situation where we had both incisor one on both sides, upper jaw and lower jaw. On investigation examination, Alice realised that these 4 teeth were actually dead. They were infected badly. The roots were, she could actually put a probe right up through the top. Not very nice discussing this, but you know, this is reality here. This is what happens. So our decision was actually to remove the 4 incisors. You'll be glad to know that we are not going to put this a photograph of that, especially just having your tea. But the idea was actually there's a very good chance that the adult incisors will come through, and taking away the infected baby teeth, that the good chance that we're not infecting the adult teeth as well. So we're really, really positive that this wee chap will go on and lead a really good life. He's also been rehomed, and the rehomer is actually well aware that we need a 6-monthly check. Now, I'm slightly changing the tact because we all like to think every horse that we like to bring into the world is going to be, you know, the best thing ever. But think before you breed. Please, please, please. I cannot stress this enough. I hope you've just heard of these afflictions, not seen them. The one on the left is called a parrot mouth. It's an extreme overshot jaw from the upper incisors are really over exceeding the lower jaw. The one on the right is what we call a sow mouth or overshot, undershot jaw. This is known to be hereditary. Why this has possibly come about is possibly because we have changed, you know, because we have interbred different types of breeds. We've interbred small ponies, horses, if you're talking Icelandics, to bigger horses, to Clydesdale Shires. But what if the conformation of the head is going to be compromised? And these are 2 classic issues there. Luckily, we don't see too many of them, but to say that we haven't seen them is not the case. We do see them. Both types are very, very difficult to keep. Both are very difficult to feed. And to think that maybe the rest of their body might be great, look in their mouths before you decide, because it's a good mare and it's done well in some discipline or other, look, think again. You do not want to bring another foal into this world like this. These horses need equine dentistry a lot. So do your future foals a favour. Don't breed from them. I can't stress that enough. So nearly at the end, Alice was just in yesterday, and we came across, it was a 11-year-old that had just come into the farm for one reason or other. And on close inspection, and it's great with these smartphones because we really can get great photographs these days. Now, it's not what we expected to see. On initial look at it, we see the molars. Oh, that's not too bad. And to the untrained eye, oh, that's not bad. But what are all these signs on the sides? And what about this? What looked like calluses? These are ulcers, in fact, not only at the back and right from over for a long time have created channels of ulceration. Not great news. However, we know this pony hadn't seen a vet or a horse dentist, well, possibly ever, but he was still able to eat, which is absolutely incredible. On more close look at this, the powers of smartphones again, you will see on the left-hand side, the right-hand side, I have to say, is just as higgledy-piggledy as this. But right to the back, you will see a corner, part of a corner tooth. I can't actually get my pointer to work. But right at the back here, you will see an appendage coming out. That's part of the tooth. You'd have thought that would have broken off. All this, all the way down the back of its throat, is an ulcer. Looking at the outside of the teeth, you see sharp, on the upper part, I should say, you see sharp edges. On the lower aspect, you see sharp edges again towards the outside. And as you can see, it's like a waterfall of ulceration. How this wee man has actually managed to eat is amazing. But Alice has now got a challenge on her hand to make his life a lot more comfortable. So my message to everybody really is, if you're wanting a pony, horse, donkey to live a long and happy life, then look after the first foremost, that's his teeth. And this is the wee man himself. He's very cute. He needs help. So thank you very much for listening, everyone.
Eileen, that is wonderful. Thank you very much indeed. Okay, it is 5 to 8, and we should finish around, or just after 5 to 8, we should finish around 15:15. We can go on a little longer. So we'll start with some questions, and we've got quite a few coming through. And Alice, if I could start with you. Someone said, as a minimum, what should we expect to see when an equine dental exam is carried out? Because not all equine dentistry have all the top of the range equipment.
Yeah, that's a good question. I think as long as the horse's mouth can be viewed properly, so you need a gag. Don't let someone do your horse's teeth unless they're using a speculum, a gag which physically opens up the horse's mouth, and then flushing all the food material out of the mouth, because as we said, we need to identify these disease processes that are going on in the teeth. So you have to get rid of all the food that's in the mouth, flushing out the mouth, and then a mirror at the very least, and a good light source so that we can see into the horse's mouth. Once the oral examination is a huge part of doing a horse's teeth, and you know, I often spend longer looking in the horse's mouth than I do anything else. Hopefully that's all then charted down on paper, and then if rasping needs to be done, then that goes ahead. And yes, if it's a vet or a registered equine dental technician, then that can be with electric rasps, but otherwise it would just be hand rasps. But a good set of hand rasps is adequate as well.
Brilliant, thanks, Alice. Eileen, I like this question. Should I expect to find my young horse's baby teeth when they fall out?
Actually, very possibly, yes. And it's actually quite a nice keepsake.
Do they go down if you leave them under the hay net?
Well, the fairy tooth, tooth fairy is could be a wee bit suspect, but you know what? I mean, we've had so many foals this year. I mean, the girls are very excited about looking for their baby teeth. You know.
Brilliant.
So yes.
I love it. Eileen, another one for you. Does the frequency of tooth checks also depend on whether they are ridden in a bit or a bitless bridle, or indeed if they're not ridden at all, in your experience?
In my experience, I think we still have to have the same frequency of checks. Yes, I mean, as I showed, I mean, a lot of them were Shetland ponies that were not ridden, and we had some serious problems. So it doesn't matter whether it's ridden, driven, not actually doing any activity, just living a nice life as a companion. I still think you very much need to keep a check on that, because you really want to be able to give them a good long life. And without good dental care, you could be shortening it. So as far as I'm concerned, yes, it's imperative.
Alice, I assume you'd agree with that?
Yes, yeah, definitely. I think often people who are riding their horse, particularly competing at the higher levels, may be more get checks more frequently, perhaps, if they feel that there's resistance on one rein more than the other, perhaps. But certainly, as we outlined, the 6-month checks for the young and old and the annual checks for everything else would be whether they're companions or ridden, for sure.
Great. A question, Alice, from Melanie. She said, my vet admitted he had rasped too much off my 10-year-old horse's teeth, and he rounded off the inside edge as well as the outside edge, which I've never seen before. So I assume that was the upper arcade. I'm worried this will affect the horse permanently, and especially in his old age. What are your thoughts on that?
Yeah, I mean, the horse's teeth are continually erupting, and a 10-year-old's teeth will still be erupting, you know, possibly 5 millimeters a year or what have you. So you know, even if too much enamel has been taken off, which occasionally can happen, in a young horse, that will erupt out again with time. I often do rasp both sides of the top jaw, just lightly, probably on the palatal side, but I do, you know, if there are sharp points, then I will take them off no matter where they are. But certainly on younger horses, the teeth are erupting at a rate that they can recover from that quite well.
Brilliant. Eileen, there's a question here. Is it correct that mini Shetlands, and I know we have plenty of Shetlands and mini Shetlands through Belwade, have full-size horses' teeth?
They have, I mean, miniatures, whether you're going to say miniature Shetlands or miniature horses, I mean, let's think we've got miniature horses coming from all over the world and claiming the miniatures. I mean, they will have a full set of teeth. How you produce that miniature, now I'm not saying it's a Shetland thing, it could be miniature anything, it's how you've actually brought and crossbred to get that miniaturization. So therefore, you have to be careful that you're going to be able to bring something into the world that's going to be able to have enough teeth to be able to last its life. If you over egg the pudding, I'm going to use that word, sorry. If you're going too big a horse into small, then you could very much come into problems in that you might not have enough mouth capacity for the amount of teeth or the size of teeth that pony might actually produce. So it is.
Yeah, so it's not so much the size, but it's just the pure number, isn't it? Because they have the same number of teeth, and therefore just overcrowding can become a real problem.
That's right. Yes, yes. I mean, we have seen some extreme breeding going on in the world, and you do question what are their mouths like? How are they going to be able to eat correctly? Yeah. So my one word is watch out for vanity before actual functional capacity.
Brilliant. Thank you, Eileen. Alice, you covered this, but someone's asked it, and it's an important thing. How can I tell if an EDT has the appropriate qualifications?
Yes, so an equine dental technician should either be registered with the BAEDT, the British Association of Equine Dental Technicians, or the worldwide WWE. So they've both got websites, and you can go on those. I think I had the slide on my PowerPoint, which you can go back to after this, but I think it's www.baedt.com. And on there's a list and a map, and you can click on your area and it will show up who is registered in your area. And if they're on that list, if they're a full member of the BAEDT, then you know that they've passed an examination, and they go to frequent CPD and have insurance, and they have a governing body to answer to. So it's either using a qualified EDT or a vet, ideally one who's interested in dentistry, is the way forward.
Yeah, absolutely. Thank you. Eileen, my horse has recently become head shy. Could this be linked to his teeth or mouth?
I would, in the first instance, I would certainly ask that question. I would get my horse examined to eliminate that maybe cause. And I mean, head shyness could be a lot of different things, but I've seen so many horses over the years, and it has been down to either overbitting, bridle tightness, etc. The horse is resenting. It's trying to tell you something. So look the horse in the mouth first, and then work from that.
Brilliant. Thank you. Alice, I have a 22-year-old who has gaps between teeth. How often should he be seen?
If you've got, it's called diastema, the gaps between the teeth, then it depends how sort of active they are. So if they're an open gap between the teeth where the food goes in and comes out quite easily, there's not much gum disease, and the horse isn't quidding or showing overt signs of pain, then possibly just getting them done every 6 months would be adequate. However, if they're more the valve type diastema, or they've got a lot of periodontal gum disease associated with the gaps, then really we want to be flushing those out more frequently. And sometimes I'll see a horse every 3 to 6 weeks initially to flush out these gaps to try and allow the gum line to heal up. But yeah, it's really, particularly summer is a good time to try and get on top of it, really, while they're hopefully mainly on a grass diet. And that allows the gum line to heal up a little bit better, because obviously in winter we're often restricted to the longer, coarser fibres of hay or haylage to chew down, and that can be more problematic for diastemata. So I would get them seen very frequently, and it's a lot of, I think, the problems with the gaps is addressing the overgrowth opposite. So even if you have a large open gap between two teeth, perhaps where a tooth was removed, or a large gap, the tooth opposite will erupt into that gap and make it worse by driving food into that space. So even just getting the teeth rasped to make sure that doesn't happen frequently, as well as flushing out all that trapped food, should make a big difference to your horse.
And is that something a dental technician always needs to do, or can the owner play a part in that too?
Yeah, you can. Sometimes if the horse is compliant, I do sometimes try and get the owner to help as well. So not only modifying the diet, so trying to be on grass, or avoiding feeds like chaffs, because often the little short spiky feeds really get stuck in these gaps. So changing onto more of a pelleted feed, getting the teeth flushed out by the vet more regularly, but then as the owner, physically flushing the mouth out, either by buying a dental syringe, or even the soft end of a hose lightly turned on, can just be a good way to irrigate the trapped food out. And some horses are very compliant, particularly if you mix peppermint oil, or even the peppermint corsadil type substance. That they're quite good for flushing out the mouth as well.
Brilliant. Eileen, we've got a human orthodontist on the line tonight as well, and they've said, can horses get caries due to having too much sugar?
Yes, so always give a horse a sugar lump. Well, actually, yes. Sugar content, you have to be so careful. I mean, we used to have, gone are the days really of polos and sugar lumps for horses. Yes, sugar does have an effect on horses' teeth. So not advisable. If you want to give a tidbit to a horse, give it a carrot, although that not too many, because there's a lot of sugar in carrots too. So be aware.
Alice, what tidbit would you give what do you give your 32-year-old?
He's still, he'll still eat carrots and apples, but in moderation. But no, you do notice if you go to a place where they feed those molasses treats, particularly that are really sticky molasses substances, you do know their teeth are far more decayed. And there was a good study actually done on dietary influences on peripheral caries, so the outside of the teeth, and the diet can make a huge difference, for sure.
Brilliant, thank you. Alice, a question here from Fiona. Can you explain floating wolf teeth, please?
So, I mean, floating would mean rasping. Wolf teeth are those small, often absent small teeth in front of the first premolar. We wouldn't often rasp them down. Horses sometimes wear them down by the bit, so sometimes you'll see just little stumps of wolf teeth that are sitting there in front of the cheek teeth, and they're usually worn away by the bit in those circumstances. I guess if you have very long wolf teeth sitting in front of the first premolar, possibly someone might rasp those down to gain access to the cheek teeth, but really you want to remove them, not rasp them down. So yeah, I wouldn't really ever recommend rasping wolf teeth. It would more be having them removed or leaving them alone.
Brilliant, thank you, Alice. Eileen, sticking with the wolf teeth sort of area, someone's asked, should I remove wolf teeth in my younger horse as a matter of course, or if only they cause an issue?
Oh, this is a great question, and there's so many ideas that are going around. Or leave wolf teeth. Well, to me, I would prefer to take the wolf teeth out. They don't actually serve a purpose, and later on in life, then they could just get in the way of bits, etc. And they're not necessary these days. I know that sounds, I take teeth out, unnecessary. They're very short-rooted, as Alice has shown, and to me, they're better out than in. For me, I would take them out.
Alice, what's your view on that?
I think the most commonly time we're presented with them are horses pre-breaking. They're getting their teeth done before they're going away to get broken in, and if they have wolf teeth, then we tend to take them out, because if they're going to be fussy with the bit while they're being broken in, it's always going to be blamed on those wolf teeth if you've left them in. If it's an older horse that we go and see that's already happily being ridden and it's got wolf teeth, then no, leave them in. There's no need to take them out. But
thank you, Alice. Alice, there's a question from Margaret. How worried should I be about buying a 3-year-old who still has all his baby incisors and a missing 2010 incisor and a problem 101 incisor that might need removing as growing crookedly?
Yeah, problem. I mean, a 3-year-old should have its adult centrals in. They're supposed to come in about 2.5, but it's not a hard and fast rule. Some, there could be 6 months given that. So, I mean, it depends if we're coming towards the end. Is it actually 3.5 and it's still got all its baby teeth? Then, chances are, I think you would want to check that the adult teeth weren't coming in behind those baby teeth. I think often that's missed. So yeah, I mean, you might be looking at a little bit of dental work going forward, taking these loose caps or these baby teeth out so that adult teeth can come through. So yeah, there might be a bit of work involved there. You'd certainly want it checked thoroughly under sedation, possibly an x-ray taken just to be sure that you're not going to have a lot of problems. But generally, even if you have, you know, problems with your incisors, they can still be very healthy, well-ridden horses.
Yeah.
The incisors are literally just for plucking the grass, and actually they can do that quite well without incisors, just sort of acting like sheep almost. So, you know, but it may require veterinary intervention if they don't all come out.
Okay, so not necessarily a no, a big no. I think we're going to have to draw to a close. But Eileen, last question. My 25-year-old retired mare apparently only has crowns left. She is still holding her weight well, so must be okay on her current diet, and has annual dental checks. Is there anything else I should do?
Well, if your mare is actually coping really quite well and she's keeping her weight on, there's nothing coming over her, just let nature take its course. Keep an eye on her teeth. Make sure that she is able to eat as well as she can, although they are coming to possibly the end of their life. But you know, horses are very resourceful, and given the chance, you know, as Alice said, there's no reason why we can't cope without them. But as long as you're looking after them, that's the main thing. Keep an eye, and yeah, happy days.
Well, listen, I'm going to come to Eileen and Alice just for a summing up comment, but just wanted to let you know that we have a great page on the World Horse Welfare website, and a link will go in the chat function, and we'll also put it on Facebook as well. So please do go and have a visit of that, and lots of other questions that will follow on from Alice and Eileen's presentation, I'm sure. So please do visit that as a resource and look at that going forward. And then we've got through a lot of ground tonight. Alice, what are your final thoughts, having heard the discussion and the presentations?
Yeah, just to get your horse's teeth properly checked regularly, a good oral examination, even if no rasping is required, to identify these problems like open pulps or caries early, so that we can put in prevention methods to try and treat these and give your horse good dentition for the rest of its life.
Brilliant, thank you, Alice. And Eileen, what's your take-home message?
I would like to think, I mean, I am amazed that people are looking at equine dentistry so well these days. My take-home message, we treat our young animals with the farriery and with veterinary, and we teach them how to deal with the farrier, lifting up its feet, etc. Look at dentistry, equine dentistry, the same way. Get your young horse used to being able to actually open its mouth and let us have a look inside. And yeah, and you know, pay attention. We pay attention to our own teeth, so we should be looking after our horses.
Brilliant. A very practical way to finish up. And listen, to Eileen and to Alice especially, thank you so much for your presentations and answering the plethora of questions so well tonight. Thank you to everyone for listening, for providing those questions. And I hope we've provided you with some practical sort of guidance and some help, and sort of give you a good sort of peer into the world of equine dentistry. And please do, as I say, take a look on the World Horse Welfare website with the link that we've provided. We'll be back in 2 weeks' time. If you've enjoyed this evening, then please do promote the recording on our YouTube channel to others in your yards and your friends and colleagues. As I say, if you've got any ideas for future webinars over the winter, then please let us know at education@worldhorsewelfare.org. In the meantime, take great care of yourselves, take great care of your horses, ponies, donkeys and mules, and we look forward to seeing you at our next webinar. Thank you so much.